Wait lang. Okay, so let's start. The public sector of the primary Philippine healthcare delivery system. Sabi nito. Ako cover. Okay, the public sector of the Philippine healthcare delivery system is divided into national and local health system through devolution. So, ano ang natatandaan nyo sa term na devolution? What is devolution? So, ano ang devolution? Naalala nyo pa ba kung anong naturo sa inyo about devolution? Sige na. Try. Wala.
Delegation of power.
From? Yeah, so devolution, delegation of power. So kung makikita natin, national and local health systems through devolution. So anong nangyari with this? The national government devolved or yun nga, dinelegate niya yung kanyang power from, kung dati kasi ang Department of Health ang nag-oversee sa lahat ng healthcare system natin. So ang nangyari is ibinaba niya, parang ibinigay niya sa mga local government yung pag-supervise ng kanilang healthcare system. So halimbawa, ang inyong health center kung noon, before the devolution law, is under siya ng Department of Health. Ngayon, your health center is under now the Municipal Health Office. So under na siyang ating health centers is managed na ng ating mga munisipyo. Okay? So, yun yun. As we continue, it is mandated by RA 7160. So, huwag kayong malilito ha. Ang RA 7160 is your Local Government Code of 1991. So, meron kasi tayong RA 7610. Diba? So you remember your RA 7610? Pangit yung sulat ko kasi pangit naman talaga, pero wala din akong pen. Kamay ko lang ang ginagamit. So pagpasensyahan nyo na ha. Ayan. Ano ang RA 7610? If you still remember it. Ito ba yung child abuse law? Anti-child abuse law pala. Yes, your RA 7610 is your anti-child abuse. So, make sure na hindi nyo napagbaliktad itong dalawang to ha. 7160 is your local government code and your 7610 is your anti-child abuse law. So, kung makikita nyo, dalawang number lang yung magkaiba sa kanila. Okay? So, the following are true about the Philippine DOH except, ang sagot natin, lahat daw ito ay true except. So, ang hinahanap natin dito ay negative. Ang hinahanap natin ay negative. So, before we answer this question, let's see kung ano ba ang functions ng ating DOH. Kilala niyo pa ba si Leah? Kilala niyo pa si Leah? Ito yung function ng ating DOH. L for leadership in health. So L for leadership in health. Leadership in health. So under this function of the DOH, sila ang nag-serve as national policy and regulatory institution. They serve as national policy and ano ba yan? Umagang-umaga. Wait lang. Hello, ba? Ayan. So, they serve as the national and regulatory institution. So, kapag sinabi mong ganito, kung makikita natin, 'di ba, as of now, sila talaga ang nangunguna sa parang pinakamalaki ang influensya kung ano yung nangyayari ngayon sa kung paano minamanage ang COVID-19. Kasi ito nga yung isa nilang function. They are the leader in health. Sila yung naggagawa ng policy, national policies. Kaya nga karamihan din ng mga protocols or strategies na ginagamit sa ating mga health centers is still coming from the DOH. Kahit nag-devolve na, kumbaga they are under the management ng ating local government, pero yung mga protocols and strategies na yung mga methods na gagamitin for our health centers is nagagaling pa rin kay DOH. Okay? Okay, so serves as a national and regulatory institution. Next is they provide leadership in formulation of policies. Wait nga lang. Ayan, ito na lang gamitin. So, they serve as your national policy and regulatory institution. They provide leadership in formulation of your policies, plans, and programs, and they serve as advocate in the adoption of health policies and plans and programs. So, yun yung mga, under the leadership in health, yun yung mga functions ng ating Department of Health. Okay? Yun yung mga functions ng ating Department of Health. Okay. Hindi pala pwede. My gosh. Sige, di ba? For the next function is, pwede na lang muna natin itong LEA, kung ano itong LEA na function ng ating Department of Health. So for letter L, they are the leader in health. So ayusin natin, take two ha. Leader in health. Ano ba itong dalawa? They are the leader in health. They are our enabler and capacity builder. Enabler and capacity builder. And for letter A is administrator of specific services. Okay. So, as enabler and capacity builder, ano ang ginagawa ng ating Department of Health? So, ito yung time wherein they innovate new strategies in health. So, pero normally, ang ginagawa na lang ngayon is we adapt yung mga policies and protocols ng ating World Health Organization. Okay? Pero dapat isa rin ang ating Department of Health na nag-i-innovate ng new strategies pagdating sa health. So as I am reading nga kahapon, like 'di ba, before time ni Aquino, we have the Formula 1 for health, 'di ba? As a strategy para mas mapaganda yung healthcare delivery system ng bansa. But then, nung time ni Aquino na, it's your Aquino Health Agenda na siya for the universal healthcare. Ngayon na time ni Duterte, naging Formula 1 for Formula 1 Plus. So parang gano'n, naibalik siya kasi nga naman si Duque ulit yung ating Secretary of Health. So yun, so dapat nag-i-innovate sila ng new strategies and siguro isa yun sa kanilang innovations na pinapakita. Okay? Ano pa, as enabler and capacity builder, they have to exercise oversight functions and monitoring and evaluation of national health plans, programs, and policies. So, yeah, they all, katulad ng mga program nila, the Sentrong Sigla Movement, diba? So they have to evaluate that always. Yan. Maraming program ang ating Department of Health. Okay? So yan, they have to monitor and evaluate those health plans also, the programs and policies. As of now nga, di ba may question dyan na asking kung ano ang Vision 2030 ng ating DOH. So as I was looking for it, nakita ko, may bago palang vision ang DOH ngayon. 2040 vision naman. Okay, so later on makikita natin yan. So next is administrator of specific services. Of course, they ensure the highest achievable standards ng quality health care. So dapat, kaya nga with partnership sa PhilHealth, they make sure na yung mga PhilHealth accredited na hospital, they deliver quality health care. Pagdating naman sa mga rural health units, they use the Sentrong Sigla movement to continuously evaluate. Also, the Field Health Services Information System, di ba, is ginagamit din siya na tool as a data gathering tool para makita kung maayos ba yung pag-deliver ng mga services natin. Okay, ano pa? As administrator ng specific services, they have to manage selected national health facilities and hospitals with modern and advanced facilities. Anong mga example ng hospital ang under Department of Health? Kaya ang karamihan ng ating mga nurses, ang mas gusto sana nila kapag nag-a-apply sila dito sa Pilipinas, lalo na kapag government, is under DOH. So halimbawa ng mga hospital na under DOH is your Baguio Gen yata, Baguio General Baguio General Hospital. So that is under our Department of Health. Karamihan ng mga regional hospitals, hindi pala regional, mga training hospitals is basta halimbawa kung nag-apply kayo at hindi kayo dumaan kay congressman o kaya kay governor, ibig sabihin that is a DOH managed hospital. So ganon siya. Pero kapag dumaan ka kay congressman o kaya dumaan ka kay congressman or governor, more on governor kasi sila ang chairman pagdating sa provincial, sa LGU. Sila ang chairman ng 'di ba, pinag-usapan natin kanina yung local government code where there is a devolution of the health system. So sila yung chairman sa provincial level pagdating sa health. So, they oversee yung mga district hospitals. Yun. Kaya sa kanila kayo pumupunta kapag gusto niyo mag-apply sa district hospital ng inyong lugar kay governor. Pero syempre kung may influence si congressman, edi sa kanya din. Okay? Ang mga iba pang hospitals that are minamanage ng ating DOH is of course your National Center for Mental Health, di ba? Your Philippine Orthopedic Center, yung mga yan. Okay? So there. What else? They also administer direct services for emergent health concerns that require new complicated technologies. Yes, and they administer health emergency response services. Okay? So katulad ngayon sila ang namamahala sa ating sa ating pandemic na nararanasan ngayon. Yun nga lang gumawa ang ating government ng panibagong parang partner nila, which is the IATF, the Interagency Task Force, na naging mas mataas na ang say kaysa sa DOH. Anyway, ganun talaga. So, yan ha, LEA. LEA is your functions of our Department of Health. So, LEA, L for leadership in health, E for enabler and capacity builder, and A for administrator of specific services. So now let's go to our question. The following are true about the Philippine DOH except that it is part of the public sector under the executive branch of the government with quasi-legislative. Anong ibig sabihin ulit ng quasi kapag sinabi natin quasi? Anong ibig sabihin ng quasi? Kunwari, kunwari ba? Kunwari ba siya? Medyo-medyo? Yan. So, quasi-legislative and quasi-judicial powers and function. When you say legislative, they make law, di ba? When you say legislative, they make law. And when you say judicial, they interpret the law. So, is our DOH have this, they have this power? What do you think? Do they have this power? Yes or no? Ang tanong is except ha. With the given function of the DOH wherein they are a leader in health, karamihan di ba sa trabaho nila sa pagiging leader in health is they make policies. They make policies. So by making policies, you are unleashing your power as a quasi-legislative. Tama ba, nurses? Yes or no? Oh, naririnig pa ba ako? Kumakain pa yata kayo. Okay, so, yan ha. They formulate policies. So therefore, they have this legislative functions and power. Letter B sabi, it is spearheads sectoral planning and policy formulation. O see, policy formulation. Kapag sinabi nating spearhead, anong ibig sabihin? Sila yung nagpapasimula, di ba? So, sectoral planning, policy formulation, and assessment at the national and regional levels. Yes, they do this pa rin. Under nga the leadership in health functions. It is headed by a secretary with cabinet position as appointed by the president. Is letter C correct? Sino ang namimili ng secretary ng DOH? The president, di ba? Sino ang secretary natin ng DOH ngayon?
Okay.
Yes, si Duque. Oo, na hinihiling ng mga nurses na magbitaw na sa posisyon. Okay? Yes. So, correct din si letter C. Okay. And it manages all the national and local. So, ito yung nagpamali with our letter D. Okay. kahit hindi natin alam yung question na to, kung naiintindihan natin itong binigay sa atin sa yung ibinigay sa atin sa situation na sabi niya devolution or the local government code, kung alam natin to, masasagot dapat natin to ng tama. Okay? The correct answer na except na hindi ginagawa ng ating Department of Health is it manages all the local health facilities. Kasi hindi naman niya minamanage ang ating local health facilities. Sino ulit ang nagmamanage ng ating local health facilities? Ang ating local government unit. Kapag sa munisipyo, ang nagmamanage sa ating mga local health facilities, tinatawag sila na local health board. Okay, your local health board. My gosh. Diba, kapag sa mga susunod na araw, magsha-shopping na nga ako ng pen. Ano ba naman ang bete na to? So, local health board. Sa munisipyo, sino ang chairman ng local health board? May I hear some answers? Guys, sino ang chair ng local health board sa municipal level? Si municipal health officer or si mayor?
Mayor.
Mayor.
Oo, si mayor. How about sa provincial? Sino ang chairman ng local health board?
Congressman.
Governor.
Si governor, yes. So, si governor ang chairman ng ating local health board. Pagdating naman sa municipal, ay sa, ang tawag nito, sa provincial level. Yes. Okay. So, yun yung nagpamali dito sa letter D. Kasi under the function of administration of specific services, they don't manage local health facilities. Okay, gumagawa sila ng protocols, policies, programs para sa mga local health facilities, pero hindi sila yung direct na nagmamanage. They train or they give oversight functions sa mga local facilities by evaluating kung kung kumusta sila sa pagde-deliver ng kanilang mga services, pero hindi sila yung talagang direct na nagmamanage. Kaya kung mapapansin nyo, iba-iba, di ba, yung ating mga munisipyo, yung ating mga health center. May mga health center, may mga ibang munisipyo na yung kanilang health center, kumpleto yung kanilang mga anong tawag doon? Yung kanilang bakuna. Pero sa API, sa inyong immunization. Pero may mga munisipyo rin na kulang-kulang. O kaya may mga munisipyo na naniningil para daw sa syringe. Libre yung bakuna, yung ibabakuna, pero sinisingil yung sa syringe. Na-encounter nyo ba? May mga na-encounter kayong ganon? May na-encounter akong ganon noon dito sa Vizcaya. Somewhere here is isang munisipyo dito sa Vizcaya. Kasi parang sabi nung mother, doon ako sa Santiago nagpapabakuna kasi may sinisingil naman dito na 50 pesos pag magpapabakuna. Kung ilan yung ibabakuna for that day, di ba? So, lalo na noon, medyo magkakahiwalay pa. Hindi katulad ngayon na ang ating bakuna is pinag-isa na Pentahib. So, we have our Pentahib. So, nandun na yung 5. Noon, magkahiwalay yung HEPA at saka yung DPT. So, magkahiwalay yung HEPA and yung DPT. So, sinisingil daw yun. Di 100 pesos kaagad yun. Kaya, pupunta na lang daw sila ng Santiago, makakapasyal pa sila. Yun. So, magkakaiba siya kasi nga, depende sa local government unit. Pero hindi ko na alam ngayon. Libre na yata kasi nung nagpabakuna naman na ako, wala naman akong binayaran nung ipinabakuna ko yung baby ko. Anyway, so the answer for number 61 is letter D. It manages all the national and local health facilities. So, hindi po. Hindi minamanage ang local health facilities. It's the local government unit that manages the local health facilities. Okay? So, ito na. Ano daw ang vision ng ating DOH by 2030? Health for all Filipinos and health in the hands of the people by the year 2020. Nag-fail itong goal ng ating. Kaninong goal ito? Kaninong vision ito? Your primary health care. Letter A is for your primary health care. Okay? So letter A is for your primary health care. So na-achieve ba natin yung goal ng ating primary healthcare? Hindi, di ba? Kasi nga, noong 2020, nagkaroon ng COVID. Kaya lahat ng efforts nawala. Yan. Next, your letter B, the Formula 1 for health. That is the, That is the
Strategy.
Yes, strategy ng ating health sector. Yes, that is one of the strategy of our Department of Health. So, anong isasagot nyo? C or D?
C.
C?
C.
Ano ang D kung yung sinagot nyo ay C? Siya ang mission. Okay?
Mission.
Yes, ito ang mission ng ating Department of Health. So, sa kinatagal-tagal ng panahon, ito yung hindi halos napalitan. Okay? Hindi siya halos napalitan. But they want to guarantee equitable, sustainable, and quality health for all Filipinos. So, estudyante pa ako, ipinapasa ulo na sa amin yan. Sabi, just remember your ESQ. Equitable, sustainable, and quality health for all Filipinos. At makikita nyo na naman dito, especially the poor. Kaya kung hindi ka poor, huwag kang mag-demand ng equitable. Okay? So, yan. And shall lead the quest for excellence in health. That is the mission of our Department of Health. So yes, the correct answer is letter C, a global leader for attaining better health outcomes, competitive and responsive healthcare systems, and equitable healthcare financing. But then, ngayon, meron na tayong bago. So, ito yung ating logo ng ating Department of Health. At sabi niya, ito na yung bago nating vision and mission. So sabi niya, Filipinos are among the healthiest people in Southeast Asia by 2022. And Asia by 2040. Kumusta naman tayo? O next year na pala eh. Next year, i-re-evaluate itong vision na to. So sabi niya, kailangan tayo ang healthiest by 2022. So what do you think? How are we faring with the vision?
Feeling.
Ilang percent kaya? Yeah, so we are lagging kasi as makikita pa lang 'di ba on how we address the pandemic. Syempre, sino bang mga kasama natin sa Southeast Asia? Kung kasama ang Singapore, wala. We fail a lot. Okay? So, 'yon. Ito na yung bagong vision ng ating Department of Health. Okay? Now, mayroon na tayong bagong mission. Kung dati, ESQ yung pinapasaulo sa amin, ngayon, PREP na kayo. PREP. So, PREP. Productive, resilient, equitable, and people-centered health system. So, ito yung lagi na lang ito yung dinidemand sa mga healthcare workers, di ba? Parang magtiis pa kayo, please, magtiis pa kayo. Laging yun yung dinedemand sa mga healthcare workers, yung resiliency. At sa mga Pilipino actually. So, yun. Do you think this is better than our old mission? Siguro kasi syempre it was made by brilliant minds, di ba? So, development of productive, resilient, equitable, and people-centered health system. Okay? So, yan po yung bagong vision and mission ng ating Department of Health. Healthiest people in Southeast Asia by 2022 and Asia by 2040, and development of productive, resilient, equitable, and people health-centered system. Okay? Now, let's go to the next number. Pag sinabi nating NHIP, what does that mean? Naaalala nyo kung ano is ibig sabihin ng NHIP? It means your National Health Insurance Program. So kapag sinabing NHIP, it's your National Health Insurance Program. Okay. So, sino ang tagapagpatupad ng National Health Insurance Program natin? Your PhilHealth. Yes, your PhilHealth. Okay. So sabi dito, the NHIP supports the 4 implementation components ng Formula 1 for Health, reducing the burden placed on Filipinos by healthcare costs. So pinag-usapan is cost. Through health investment is in support with your health financing. Okay, your health financing. So yan ang sagot sa ating the health financing. So yes, yung 4 na yan, they are the components ng ating Formula 1 for Health. Tingnan natin. So, sa pagdaan ng panahon, ito yung ating reforms sa ating healthcare delivery system. Yun nga, ang goal ng ating Department of Health is the Health Sector Reform Agenda. So that is the overriding goal of our Department of Health. And then, your Formula 1 for Health, it is under your HSRA. Okay. So kung makikita natin, mula 1990 hanggang 2004, the goal is to improve health service delivery, financing, regulation, and governance. Under the Formula 1 for Health, they want to ensure access and availability of foods and services, increase better and sustained service delivery, assured quality and affordability, improve health system performance. And then from 2010 to 2016, we have na your universal healthcare. So dala-dala pa rin niya yung health service delivery, financing, your regulation, and your governance. So dinagdag lang yung resource and health information. And now we have the Formula 1 Plus for health. Okay? So as of the moment, yung Formula 1 meron lang siyang plus. Now let's go to number 64. Which of the following laws drastically change the landscape of her? Kapag sinabi mong drastically, biglaan, di ba? Change the landscape of healthcare delivery system in the Philippines. So, anong law ito? Your?
C.
Yes, your RA 7160. Ano ulit yung ating anti-child abuse law?
7610.
7610. Now, what is 7164?
Local Government Code.
64. This is your old Nursing Act, di ba? Your Nursing Act of 1991. So RA 7164 is the Nursing Act of 1991. Now, what is your RA 9173?
Philippine Nursing Act of 2000.
Yes, that is your Philippine Nursing Act of 2002 naman. Nursing Act of 2002. And RA 7305?
Magna
Yes,
Carta of
Magna
Public
Carta
Health
for
Workers.
Public Health Workers. Yan yung nilalaban ni sino yung nagsalita. Please review your Magna Carta for Public Health Workers. Nung nag-demand sila, bakit ang tagal na hindi pa binibigay yung kanilang, ano yun, yung bayad, mga bayad sa hazard pay. Yes. Oh, thank you. Okay. Number 65. During out, so the answer here is yes, letter C. Number 65. During an outbreak of dengue, who is the most accountable person in the municipality? Sino ang accountable daw sa munisipyo dahil nagkaroon ng outbreak? Yung Aedes aegypti ba? Yung lamok? Sinong sumagot ng boy? Ang tinatanong person ha? Person po ang tinatanong. Hindi kung sino ang vector. Kaya mali si letter boy. Yan ay yung una nyong i-eliminate. Siguro parang kung ito ang sinagot mo, feeling ko hindi mo tinapos yung tanong hanggang during an outbreak of dengue ka lang. Okay? So, what would be your answer?
Municipal Mayor.
Yes, the municipal mayor. Bakit si municipal mayor?
Municipal.
Siya ang head ng local health chemist.
Head ng municipal.
Siya ang head ng local
LGU.
health board. Yes. So si municipal mayor, siya ang head ng local health board. So therefore, siya ang most accountable person kasi bakit hindi siya pero ang gagawin lang naman, pero in reality, ang gagawin lang ni municipal mayor, papagalitin niya to, di ba? Yan, papagalitan niya yung municipal health officer. Okay. Next, traditional, tayo sa ating traditional healthcare. So under the traditional healthcare, nandito ang inyong herbal medicines and also your alternative practices katulad ng inyong acupunctures, ganun. Okay, ng inyong mga ventosa, like that. Okay, so ang tanong sa number 66, Traditional and Alternative Medicine Act refers to which of the following laws? So ano daw ang mga ang ating law for your Traditional and Alternative Medicine Act?
Boy.
Letter boy. Yes, very good. So RA 8423. Kaya kung ito ang pinakauna nyong, syempre isa ito, dalawa na pala. Yan. Ano ang LOI 949? Syempre, una mong i-eliminate yan, di ba? LOI 949. Ano ulit ang letter of instruction 949? Ito ba yung nagpatunay na kailangan nang i-adapt sa Pilipinas ang primary health care? Yes, so this denotes the adoption. Ito yung instruction ni Marcos na sabi niya, we have to adopt the adoption of primary health care in the Philippines. Okay, adoption of primary health care in the Philippines. Okay, so yan yung, ito siguradong alam niyo to. Ano ito? EO 51?
Breastfeeding.
Rules
Diba? Milk code.
Milk code.
Ano ang nakapaloob sa milk code? Ano ang mga sinasabi ng milk code? Kahit lang. Summary. Ano? Bawal Ano ang
Bawal
bawal?
feeding bottles, ma'am.
Bawal i-promote ang mga formula milk.
Formula.
Sa hospital kasi may panahon yata noon na ang daming mga posters ng formula milk sa hospitals at parang yun na yung pinopromote ng ating mga healthcare workers. So under the EO 51 dapat hindi yon ginagawa. Kaya ano yung Breastfeeding Act? You still remember ano yung Breastfeeding Act? Diba dalawang suso yun? RA
128, ma'am.
128. Yan ba yung bago? Yung lumangay? Your RA 7600. Okay? Your RA 7600. Wait nga, tignan ko kung yung bago yung sinabi niyo. So, RA 7600 is your Breastfeeding Act. Okay? Breastfeeding Act. Ayun. So, yung 128, yung sabi ni ma'am, is an act expanding the promotion of breastfeeding. So, it amends your RA 7600. Yes, thank you, ma'am, for the update. Okay, so your 128 is your Expanded Breastfeeding Act. Okay, RA 128. Pareho pa rin, ano, dalawang suso pa rin. RA 128 is your Expanded Breastfeeding Act. Okay po tayo? So, yan. Now, ano naman ang PD 825? Ang PD 825 is penalty for improper garbage disposal. Penalty for improper garbage disposal. Okay, thank you. Now, let's go to number 67. So a group of patients in the community is seeking the help of the community health nurse on the appropriate herbal medicine to use. So appropriate herbal medicine to use. Which of the following patients require a need for further teaching? A need for further teaching, ibig sabihin we are looking for a negative answer. So what would be our answer here? Tama ba na kapag ang pasyente may diarrhea, gumamit siya ng bayabas?
Yes.
Pwede, yes. Pwede naman. Lalo na yung bunga, di ba?
Yes.
Yes. O, tama ba na kapag may type 1 diabetes, gagamit ng ampalaya?
Yes.
Yes.
Are you sure? It's
Yes, ma'am.
type
Ay,
1.
1.
Diba? Ang paggamit ng ampalaya is recommended only for type 2 diabetes. Actually, karamihan ng herbal plant na ginagamit for diabetes according to studies is for type 2. Type 2 diabetes. So letter B is the incorrect. Now, a patient with toothache, gagamit ng bawang? Yes.
Yes.
Ginagamit yan kasi ang bawang meron siyang antibiotic properties. A patient with lithiasis. Ano ulit ang lithiasis? Stones. Diba?
Stone kidneys.
Stone
Yes.
kidney. Yes.
So gagamit ka ng sambong?
Yes.
Okay, so the incorrect answer here is your letter B, type 1 for, ampalaya for type 1. It should be type 2. Okay tayo? Okay, now let's proceed to number 68. Which among the following is not prepared through boiling? Alin daw dyan ang hindi binuboil? Ang lagoon, di ba, kapag gagamitin mo for calf, you boil it, di ba? Yung
Yes.
kanyang leaves.
Yes, ma'am.
Yung tsaang gubat, leaves din yan, binoboil din.
Yes.
Yung sambong, leaves din yan, binoboil din. Nyug-nyugan ang hindi binoboil. Kasi, ang ginagamit dito is yung seeds ng nyug-nyugan. Para saan ulit ang nyug-nyugan?
Anti-helmetic.
Yes, your anti-helmintic. Okay. Good. Now, number 69. The application of needles in the ears is known as ears. Ano ang ibang tawag natin sa ears?
Auricle.
Auricle. So, what would be your answer?
C.
Yes. C. Auriculotherapy. Your auriculotherapy. So, please take one na they use needle. Diba? There is a use of needle. Itong acupressure, mga pressure lang ang ginagamit dito. Acupuncture, ayan, sa ulo, sa body. Kapag naman sa tenga, auriculotherapy. And then your aromatherapy. Okay, next. Nakuha itong dalawang question na to. Tumama kayo. Bakit nagkakamang? Wait lang guys, naghang, I guess. Ayan. Okay, number 70. The rhythmic combination of gentle moves with deep breathing and meditation refers to which alternative practice? Okay. So, alam ko halos lahat sa atin ito yung sinagot, 'di ba? Yoga. But there is a more correct term for this definition. It refers to your qigong. Your qigong. Okay, letter B is the correct answer for this number. So, please take note that in qigong there is a rhythmic. So, ibig sabihin, repeated number of times yung mga movements na ginagawa. Often, stretching the body. So, yes, stretching din katulad ng yoga. But there is a repeated movements. There is a rhythmic combination. Okay? So, yun yung difference ng qigong. Next. Okay, punta na tayo sa environmental health. It's a branch of public health that deals with the study of preventing illnesses by managing the environment and changing people's behavior to reduce exposure to biological and non-biological agents of disease and injury, and so on. Okay. Ngayon, ang tanong sa number 71, Clean Air Act daw ng 1991 is otherwise known as your RA?
8749.
Yes, your RA 8749. RA 8749. So you look kung ano na itong mga ibang RAs natin. Okay, for 72, point source is considered as level 1 approved type of water facility. So naalala nyo pa itong mga to, level, mga approved, wait lang ha, ang ingay nila. Okay. So do you still remember the level 1, level 2, and level 3 approved type of water facility? Kapag sinabi nating poso, poso, yung, Jetmatic, anong level na yun kaya ng water facility? Guys, kapag sinabi nating Jetmatic, anong level ng water facility yun? Oh, tumahimik na naman sila. Okay. Kapag yung mga Jetmatic na yan, lalo na kapag nagsaserve siya ng 100 household, which is hindi na makatotohanan sa panahon ngayon. Noon kasi, of course, ang isang poso, maraming gumagamit, di ba? And let's review first our approved type water facility para mas malinaw, ha? So we have here 1, magsulat ka, 1, level 2, and level 3. So punta muna tayo sa taong sineserve niya. Okay? So sa level 1, ang dami ng tao or ang dami ng household na sineserve ng level 1 should be 15 to 25 household. 15 to 25 household. Ang level 2 naman, ang dami ng bahay na sineserve niya should be 100 household. Okay? 100 household. Now, sa level 3, ang dami ng bahay na sineserve niya is madami na talaga, parang kaya niyang bigyan ng individual connection bawat bahay. So, it can give individual house connections. Katulad dyan sa Baguio, di ba, meron tayong Bawadi. Individual, gamit tayo ng kamay, individual house connections. Okay? So, individual house connection kapag level 3. So, ang example ng level 3 is yung ating Nawasa, Bawadi, ganon. Okay? Now, ano pa yung pinagkaiba ng level 1 at level 2? So, sa level 1, ang pinakamalayong user should be 250 meters away. 250 meters away. Yung pinakamalayong user ng water facility. Okay? Kapag level 2 naman, ang pinakamalayong user is ganun din, pareho lang pala sila, 250 meters din. Okay? Pareho lang. Anyway, yan na yan. So, what else? Punta na tayo sa example kasi yun naman yung karaniwang tinatanong sa exam. Yung mga example ng water supply is, ito is dapat your, mali yung letter A kasi this is unapproved. Letter A will be unapproved. Kasi dapat merong cover yan para maging approved siya na type of water facility. So hindi lang basta nagdag ng well, it should be meron din siyang cover. Okay? So letter A is wrong because it is unapproved. Okay. Letter B, from the word itself, unimproved. So ibig sabihin, walang improvement doon sa ubbog. Ubbog yun eh. Alam niyo kung ano yung ubbog? Spring, yes. So unimproved is springs. Of course, this will also be unapproved because it's unimproved. So paano ba nila ini-improve yung spring? Ito yung ginagamitan nila ng mga water tanks. So ginagawan nila, kaya kung mapapansin nyo, when you are, kapag bumabiyahe kayo, di ba, dito sa Mountain Province or dito sa may Benguet, makikita nyo meron yung mga na semento na parang box type kung saan doon nila iniipon yung mga nanggagaling sa ating spring. So, kapag yun na-disinfect pa and then it become approved type of water facility. So, this is also wrong because it is unimproved. What else? Needs priming. Wells that needs priming. Kasi daw, yung well, kapag hindi siya nagamit ng 10 years or 2 years, pag hindi na siya nagagamit ng 2 years, kailangan i-disinfect yun, kailangan linisin. So, letter dog is also wrong. So, the correct answer would be letter C. It should be disinfected wells at dapat covered yan. So, yung balon na yan ay dapat may takip para masabi na approved type of water facility siya. Okay? So, ano ang examples natin for our level 1? It is your protected wells. Ibig sabihin ng protected is meron siyang cover and your developed spring. So kapag developed spring, may pinag-iipunan ng tubig, gano'n, na malinis, of course. Okay, developed spring. Now, yan para sa ating level 1. Na ano naman ang examples natin para sa ating level 2? So ang ating level 2, ito na yung mga faucets. Communal faucet system. Okay, so communal faucet system and of course your stand-alone post. Yung stand-alone post, yun yung ang example nun is yung Jetmatic na bombahan. Okay? Stand-alone post. Alam nyo yung Jetmatic? Baka hindi nyo alam yun. Siyempre, alam nyo yan kasi nag-community naman kayo. Nakakita kayo siguro. Okay? And of course, para sa ating level 3 is yung mga waterworks system. Yung mga waterworks system. Okay? So ito ang mga levels ng approved type of water facility. Okay, so sige nga, let's review. Kung maalala. Sige. Yun. Pag sinabi nating level 1, ilan ang sineserve na kabahayan?
15 to 25.
25.
25.
Very good. Pag level 2 naman?
100.
100.
Yes. Kapag level 3?
Individual house connection.
Individual house
Connection.
Yes, individual household. Now, anong level ang ating protected wells?
Level 1.
Level 1.
How about the Baguio Water District?
Level 3.
Level 2.
Okay. How about your communal faucet?
Level
2.
Level 2. How about yung barangay water system na ang kabahayan doon ay 100?
Level 2.
Level 2.
Kahit system siya, pero kung ang sinaserve niya lang ay 100, it still fall to level 2. Very good. Okay, so now let's go to number 73. Which of the following is inaccurate about approved type of toilet facility? Inaccurate about approved type of facility. So, mali yung hinahanap niyo ulit. So, level 1 includes pit latrine and aqua private. Do you think this is correct? Level 1 is pit latrine. Ano ulit ang pit latrine? Naalala niyo pa kung ano to? Ito yung, hindi nyo na siguro to naabutan para sa amin na nasa 30s lang ito. Okay, so,
Magsuswat ka.
yes. Ito yung they dug. Magdadag ka ng butas sa yung ano yan, sa lupa of course, and then they will cover it with woods, tama? So, i-cover nila yan ng tabla. Tapos, merong butas. Gagawa ng butas, yan, dyan ka na. Dyan na pwedeng tumae. Okay? So, be careful lang pag tumae, baka lalabas naman yung langga. So, that is pit latrine. Okay? That is pit latrine. So, yes, it is approved type of toilet facility. It's level 1. So, tama yung letter A. Yung aqua privy is kunyay. Yung mga nakatira sa dagat, ganun. So, parang ganito rin kaso sa karagatan. Okay? Next, your level 2 includes water sealed type, including those that are requiring pour flush. So, ito na yung meron sa ating mga bahay. Okay? So, ito na yung meron sa ating kabahayan. Level 2 na po yan yung mga ginagamit natin. Kasi, hindi siya connected to a sewerage system. Which is, yun yung pinagkaiba ng level 3. Yung level 3, it includes facilities na, yes, merong septic tank, pero nakakonect din yung septic tank na to sa sewerage system. Okay? So, nakakonect din siya sa sewerage system na nagtitreat ng mga nagtitreat ng ating mga waste. Okay? Human waste. So, dyan sa Baguio, yung treatment facility dyan is dito sa may sanitary camp. Yes, so dyan sa sanitary camp. So, correct ang letter C. Now, level 2 and level 3 are both water carriage facilities. However, the latter has treatment facility. Okay, tama rin naman. Oh, okay, yes. So, letter D is, yes, correct. So, okay, but sorry. Ang mali pala sa letter boy is yung pour flush. Pour flush. Kasi ang pour flush is under your level 1. So, halimbawa itong pit latrine kasi na to, di ba? Ayan. Tapos, nilagyan nyo na ng tabla. So, yung pit latrine, diretso kasi ito na merong butas. So, diretso dito na merong, hindi na-erase mo amin. Wait lang, mag-drawing tayo ha. Para mas ma-appreciate nyo. So, yung dinag nyo, merong butas dito. Pit latrine yon. Ngayon, kapag nilagyan mo siya ng, di ba kung maalala nyo, hindi ko lang alam eh. May time kasi noong 1990s na namigay sila ng plastic na inidoro. Plastic na inidoro. So para hindi diretsong butas yung meron sa ating mga pit latrine. So during that time merong plastic na inidoro na yun yung ilalagay mo dito. Okay? So yan. So syempre kapag plastic yan na inidoro, kailangan mong buhusan ka ng isang mga isa or dalawang tabo ng tubig. So yun yung pour flush. May iba naman na hindi nabigyan, ang ginawa na lang nila is parang kumuha sila ng galon, tapos yun yung inilagay nila, parang ipinako ulit nila dito. So ganyan na siya. So syempre kapag tatai yung tao, from here, diretso lang dito. So hindi na siya hindi siya diretso dito na parang magkakos ng splashing or something. So dito muna siya sa plastic na to na nakapako, dito muna siya, and then bubuhusan niya ng tubig para mahulog yung waste from here papunta dito. Okay, so ganun kapag pour flush. Okay, that is the pour flush method. Ngayon, baka ma-encounter nyo rin yung antipolo type sa mga next na next na exam. So, yung antipolo type naman na style is, syempre alam naman natin sa antipolo is bulubundukin doon, 'di ba? So, ang nag-introduce ng antipolo type is yung mga kano, yung mga Americans. Hindi nila magamit yung water sealed type kasi nga mahirap magdala ng tubig doon nga sa Antipolo kasi bulubundukin nga. So ang nangyari, ang ginawa nila is, kunwari, this is para din siyang pour flush method pero mas modified pa siya. Kasi nga yung slope doon sa Antipolo. So, wait lang. So kung ito yung ginawa nilang butas, kung ito yung side of the mountain, so ito yung butas. Andito. So, andito yung butas. Now, andito yung kanilang pinaka-toilet. So, andyan yung kanilang pinaka-toilet. So, nandito yung kanilang parang pinaka-inidoro. And then, may maliit na tubo lang na nakadugtong kaagad doon sa butas. Siyempre, this is covered. Okay? So, this is covered. Para din siyang pour flush method, pero ginamit nila yung slope para makatulong na bumagsak kaagad yung dumi. Para mas konti lang na tubig yung magamit. Okay? So, clear tayo ha? So, kapag Antipolo type, this is also level 1 kasi modified version lang siya ng pour flush method. Okay tayo? So, the answer for number 73 is letter boy. Kasi yung pour flush method is under siya ng level 1. Okay? Level 1. Okay? So, natatandaan? Sige nga, tanungin ko kayo. Anong level, anong level ang Antipolo type?
1.
Level 1.
Kapag pour flush,
1.
Level 1.
kapag yung CR ninyo sa bahay ninyo sa province, na pour flush.
1.
1.
Yes. How about yung CR nyo dyan sa dormitory nyo sa Baguio? Na building talaga siya, building. Ay, wait lang. Bakit 1 ang sinagot nyo dun sa, pour flush kasi ang tinanong ko nga pala. Okay. Yung CR nyo dyan sa dormitory nyo sa Baguio na nasa isang building. Building talaga na maraming floors.
2.
Na nasa Central Business District.
3 kung nakakonect
3.
3.
Yes. Karamihan ng mga nandyan sa Central Business District is dapat nakakonect sa sewerage. Sa sewerage. Yes. Okay. Kapag mga water sealed lang, nakakonect lang sa septic tank.
2.
Yes, 2. So, anong level ng water facility yung undeveloped spring?
1.
Undeveloped?
Hindi siya approved,
1.
ma'am. So,
Yep.
it doesn't
Hindi
belong
siya
pa.
approved. Yes. Hindi siya approved kapag undeveloped spring. Okay? How about yung well, covered naman siya, pero iniwan nyo siya ng 10 years.
Hindi rin siya qualified, ma'am, kasi kailangan i-disinfect before siya gamitin ulit.
Yes, very good. Okay? How about yung mga water facility na nagsiserve ng 100 household?
Level 2.
Level 2. How about your protected well?
Level 1.
Level 1.
Level 1. How about your Antipolo type?
Level 1.
Level 1 toilet.
Your aqua privy?
1.
1.
Okay. Yes, so thank you for your participation. Now let's go to number 74. The following are policies of the food sanitation program ng ating Department of Health. Select all that apply daw. Okay? So first, Food establishment are subject to inspection of all its food source containers, including transport vehicles. Is this correct? Yes, kailangan sila ma-inspect if they are following standards. Number 2, food establishment should comply with sanitary permit requirements, obtaining classification, whether Class A, Class B, or Class C. So this is also correct. Okay? Kaya nga, yung mga food handlers natin, every year yung mga yan is talagang pinapakuha sila ng health card.
Yes.
Kaya laging punuan yung tao dyan sa may City Health Office dyan, City Health Department dyan sa Baguio. Okay? Number 3, food establishment should comply with ito, yun, sinasabi ko pala, the health certificates. At suot-suot dapat nila yan kapag nagsiserve sila. Kaya kung mapapansin nyo, yung mga sa McDo, yung mga, or sa Jollibee, yung mga servers nila, di ba, ang daming IDs yung nakalagay sa kanila. Yes, sa kanilang breast area. Okay? Food establishment should destroy or ban food that is unfit for human consumption. Course, o kailangan nilang i-kwan yan. Kaya nga hindi nagpapauwi ng tira-tira yung ating mga, lalo na yung ito nga, yung mga kilalang food chain. So, hindi sila nagpapauwi ng tira-tira sa kanilang kwan. Kasi it's under the Department of Health Guidelines pagdating sa policies ng food sanitation. Number 5, ambulant food vendors shall comply with requirement of acquiring health certificate. Ito ang hindi masyadong di ba? Ito yung hindi masyadong namomonitor ng ating mga local government units, yung pag-acquire ng health certificate ng mga ambulant food vendors. Pero kasama siya sa policy ng ating food sanitation. So, siguro yung nasa Burnham, yung mga vendors doon, of course, may kukunin silang permit so kailangan talaga nila ng card. Kami nga rin sa review center, meron kaming health certificate also, yung green naman sa amin. So more on, ang chine-check nila is x-ray, stool, and yun, more on stool and the x-ray. So yun yung kailangan namin ipa-check every year. And syempre, ang x-ray valid naman siya for 2 years. So yun. Yung stool, yun, every year yan. So kailangan, pag magre-renew ng permit, we have to submit stool specimen for examination bago nila mapirmahan yung aming sanitation permit. So, ganun yung mga policies. Hindi lang sa food sanitation, kundi sa lahat ng mga legal na businesses. Okay? So, yes, the answer for number 74 is letter A. Letter A. Number 75. Bottles and broken glasses are considered as rubbish waste. This should be segregated using which color? Following the garbage disposal protocol. So what's your answer here? Kapag orange, ano to? Ay kapag D, ito na lang. Pinaka-common. Anong binabasura nyo sa yellow?
Infectious.
Yes, you're infectious. Kapag green,
Biodegradable.
yes, yung biodegradable or nabubulok. So black, non, yes, dito na yung mga non-biodegradable. So our answer is letter B, your black. Black. Pag orange, anong natatandaan nyo pag orange?
Toxic.
Toxic, yes, you're toxic. Okay, now let's go to our sige nga, reviewin natin yung mga nadaanan natin kanina ng mga Republic Act. Kapag EO 51, ano ulit yon?
Milk code.
Milk code. How about your RA 128?
Expanded
Expanded breastfeeding.
breastfeeding.
How about your RA 7600?
Breastfeeding Act.
Anti
Yes, your Breastfeeding Act. How about your, ano ulit ang inyong devolution law?
Law?
Yes, devolution law. Tinatawag din siyang devolution law.
RA
7160.
7160.
Yes, very good. Your anti-child abuse law.
76.
76,
10.
10. How about your LOI 949?
Adoption of
Adoption of primary healthcare in the Philippines.
Ano naman ang Nursing Act of 1991?
7164.
7164. Ay, yung inyong 9173.
Philippine Nursing
Nursing
Act of
Act of
2002.
Yes. Okay. Your PD 996, ano ito?
API.
Yes, your EPI law. Your EPI law. So, your expanded program of immunization. Now let's go to, okay. Now, let's go to the question. Sabi, tetanus elimination campaign is mandated through your, what is our answer? It's your Presidential Proclamation 1066. The answer here would be your Presidential Proclamation 1066. Okay? Yan. Next, number 77. Which among the following vaccines will be given at the age of 9 months? Alin daw dyan sa mga vaccines na yan ang maibibigay at the age of 9 months?
Letter D.
Letter? Ano ang D?
Measles.
Yes, your measles vaccine. Your measles vaccine. Okay? So, alam naman na natin na ang BCG is para sa inyo. Tuberculosis. How about your OPV para sa?
Polio.
Polio.
Polio. Your Pentahib para sa?
Diphtheria. Hepa.
Yes, diphtheria.
Hepa.
Hepa. Pertussis.
And
Tetanus. Hepa.
B.
Ano yung Hib? Ano ito?
Hib.
Kasi penta o 5 daw.
Haemophilus influenzae.
Yes, very good. So your Hib is for the Haemophilus influenzae. So diphtheria, pertussis, tetanus, hepa, and your Haemophilus influenza para sa flu. Okay? So the answer for this is yes, letter D as ang para sa inyong measles covalent vaccine. Okay, number 78. Which among the following is incorrect about rotavirus? Para saan ulit ang rotavirus? Later, I will ask for a break. Okay? So, rotavirus is para sa inyong rotavirus gastroenteritis. So, letter A is correct. Okay? Letter A is correct. Paano nyo ina-administer ang rotavirus? Is it given by a shot or by mouth?
By mouth.
Yes, it is given by mouth. So correct C, letter B. So now, the minimum age for dose 1 of rotavirus vaccine is 6 weeks. The maximum age for dose 1 is 14 weeks and 6 days. So, or the minimum interval between doses is 6 weeks. What would be our answer here?
C.
Learn. Rotavirus. Okay. So, minimum interval between doses is? The answer would be letter dog kasi pwede nyo siyang the minimum interval is 4 weeks. Okay? 4 weeks. Karamihan naman ng ating mga vaccine, di ba? Ang kanilang interval is 4 weeks. Ang kanilang minimum interval is 4 weeks or 1 month. So, our rotavirus, you will give it at 6 weeks and then 10 weeks. Okay? You will give the first dose at 6 weeks and then you will give another dose at 10 weeks.
14 weeks and 6 days.
Yes. Yun is the maximum age for dose is 14 weeks and 6 days. So, pwede mo pa siyang ibigay during that time. With rotavirus kasi, may time na hindi nyo na siya pwedeng ibigay kasi it may cause intussusception. So, what is intussusception again? It's your telescoping ng inyong intestines, right? Okay? So, yun, letter dog is our answer here. Because the minimum interval between doses is 4 weeks. That is also the same with your pentahib and your OPV, di ba? It's also the same with your penta and your OPV. Okay, so yan. Next number 78. Which among the following is administered via SQ route? Subcutaneous daw. Binibigay through your subcutaneous. Alam naman natin na ang BCG, paano ang kanyang administration? BCG.
Intradermal.
Yes, your ID. How about your OPV?
Oral.
Oral. How about your DPT?
Intramuscular.
IM. And your MCV, yes, this is your subQ. The answer for this number is our letter D, MCV. Number 80, which among the following is an absolute of contraindication to vaccination? Your absolute. Ibig sabihin, hindi mo talaga siya pwedeng ibigay kapag may nangyaring ganito.
Boy,
yes. So DPT if the child has a convulsion in the previous dose. Okay, let me check. Nagbigay ka ng OPV pero may diarrhea. Would you count that as a dose?
no.
No.
Yes, very good. Hindi mo siya ika-count as a dose. Ibinigay mo lang siya during that time para hindi, ang tawag doon, hindi ma-disappoint yung mother kasi 'di ba nag-effort sila na pumunta sa health center kahit na may sakit yung anak niya. So for them na parang to continue na kunin yung services ng health center is yun, more on behavioral reasons kung bakit nagbibigay tayo ng OPV kahit merong diarrhea. Okay? So, nakuha yon, ha? You don't count it as a dose. Okay? You don't count it as a dose. DPT, if the child has a convulsion in the previous dose, yes. Ano ang nagko-cause ulit ng convulsion dito?
Very high fever.
But anong vaccine dito sa tatlo ang nag-cause ng convulsion? Ano ang nag-cause ng convulsion? Your pertussis. Okay? Your pertussis. So siya yung reason kung bakit nagkakaroon ng side effect na convulsion yung ating child. Hindi kinakaya nung system ng bata yung pertussis na to. Okay? So, ang ginagawa sa ibang bansa, they give the DT. Parang yung modified vaccine, which is yung diphtheria and tetanus lang. May mga others naman na DTaP. So, acellular. Kasi yes, your pertussis kasi killed bacteria siya, pero buo pa rin yung bacteria na papasok sa katawan ng bata. So ang ginagawa with DTaP, parang a portion lang ng bacteria na yon ang ihahalo doon sa vaccine to develop the immunity. Okay? So kung talaga, syempre gusto naman natin na mag-develop ng immunity yung bata against pertussis. That's why nag-develop sila ng DTaP. Ngayon, kung wala pa rin, meron pa rin convulsion kahit nagbigay ka na ng DTaP, and then kailangan na ito na talaga, yung DT na lang yung ibibigay. I'm not sure if this is available na in the country, pero syempre sa mga health centers natin, hindi siya available. Yung ganitong modification ng ating vaccines. Siguro sa private, this is pwede, meron ito. Okay? So, yon, ang nagko-cause ng convulsion dito sa tatlong ito is your pertussis. So, kapag merong convulsion in the previous dose, huwag na lang natin siyang ibigay. You can refer them, kung talagang gusto ni mother na ma-immunize yung bata, you can refer them to a private doctor, to a private clinic para makuha nila yung option na ito. Yung they can have the diphtheria and tetanus or the DTaP. Okay? So that is for 80. Since 10:23 na, can we have a break? Kasi restless na yung mga alaga ko. Sige po. Break muna tayo, 15 minutes. Let's be back by 10:45. Thank you. Okay, so let's continue with our Rasho. So the topic here on this, naririnig ba ako, guys?
Yes, ma'am.
Okay. O bakit parang dapat ka energetic? Okay, so the IFCI was initiated jointly by the World Health Organization, of course, our Department of Health and UNICEF, in order to address the health situation in the Philippines. Kung titignan natin sa ating manual ng IMCI, sabi niya, noong 1990 is nagkaroon ng findings ang ating World Health Organization at ang UNICEF. Anong ibig sabihin ng UNICEF ulit? Your United Nations International Children's Emergency Fund. So nagkaroon sila ng finding na nakita nila na yung mga bata before reaching the age of 5, 10 times na mas maraming namamatay sa mga developing countries. Ang Pilipinas ba is kasama sa developing countries? Yes or no? Yes or no? Philippines is under developing countries? Is still a developing country?
Yes po.
Yes. So yes, Philippines is one of them. So nakita nga na 10 times na mas maraming namamatay sa mga developing countries. That's why the World Health Organization and UNICEF, they develop a strategy to combat this problem. So what strategy did they develop? Your IMCI, or the Integrated Management of Childhood Illnesses. The World Health Organization and UNICEF, ang ginawa lang naman nila is pinagsama-sama nila lahat ng programs and strategies para sa mga may sakit na bata for common illnesses. So, they bring it all together, pinagsama-sama nila. Before IMCI, what happened is fragmented ang approach pagdating sa mga health centers. Fragmented ang approach pagdating sa mga may sakit, sa mga dumarating doon na pasyente. So halimbawa si mother, dumating sa health center, dala niya yung anak niya. Tinanong ngayon ni healthcare worker, ano po ang problema, nanay? Sabi. Ang sanabi ni mother is, kasi meron pong ubo yung aking anak, sabi ni mother. So therefore, ang gagamitin ngayon na management ni health worker is your CARI or the care for acute respiratory infection. Yun lang yung gagamitin niya. And then, kapag pwedeng pauwiin yung bata, papauwiin na niya. Hindi na niya i-check yung ibang problema ng bata. Excuse me lang. Okay, sorry for that. So ganun, fragmented ang approach. Kung nagdadayariya naman yung bata, yun yung chief complaint nila doon sa health worker is nagdadayariya. They will use the approach, your CDD naman ang gagamitin nila. The CDD or Control for Diarrheal Diseases approach. Or kung dumating yung bata, tapos sasabihin lang nila ng nanay na, kasi hindi magpapabakuna po sana. So, yung EPI naman yung gagamitin. O kaya kung pupunta sila, kasi hindi kumakain yung anak ko. So, nutrition naman, somewhere on the nutrition protocols or nutrition strategies ang gagamitin. So, ganun siya. Hiwa-hiwalay yung way nila na mag-manage ng bata before the IMCI. But nung dumating IMCI, in-integrate na niya lahat. Pinagsama-sama na niya yung mga strategies on how to care for under 5 years old. So, as you can see here, sabi niya, this program has been developed to significantly reduce mortality, pagkamatay, morbidity, pagkakasakit, associated with the major causes of diseases. So, syempre, yung under IMCI, hindi naman lahat ina-address niya. Mga common childhood illnesses like your pneumonia, your diarrhea, measles, malaria, dengue. Ngayon, kasama na ang HIV/AIDS. Sa Africa, kasama ang TB, tuberculosis. So, kasama yun sa inadapt nila sa kanilang guideline. Also your neonatal infections. Yan. So, yung mga common causes lang ang chine-check natin under IMCI. Okay tayo? So, do you still follow? So now, let's go to, so yun ha, ang IMCI, ini-integrate, it's an integrated management. Kinuha si CARI, kinuha si CDD, kinuha si EPI, kinuha si nutrition, kinuha si yung pagdating sa mga dengue, kung paano, yung sa dengue naman, yung pagmamanage sa dengue, at ipinasok siya lahat dito. Okay? So this is, your IMCI is also an evidence-based strategy. Okay? It is a program, it is a strategy that is evidence-based, of course. And they made sure na anong tawag nito? Kasi karamihan sa dahilan kung bakit, di ba, ang mga developing countries is mas maraming namamatay kasi nga we lack resources. So with IMCI, they made sure na hindi siya mahal na strategy, hindi siya mahal na program. Okay? So now let's go to The question, 81. The IMCI chart provides the necessary procedure when identifying the appropriate interventions to be done. However, the community health nurse should be aware that which among the following factors should be considered in utilizing the case management chart. So yes, meron kang case management na ginagamit sa IMCI. Maganda nga kasi madali lang to eh. The case management process follows this guide, your ACIT CG. So first, of course, kapag you follow the case management process na nakasulat dito sa case management chart, makikita mo yung first step na ginagawa natin with the case management chart is we assess the child. And then we classify the illness. Yes, we classify the illness. I4, identify your treatment. Identify the treatment. T4, you treat the child. C4, counsel the mother. And G for give follow-up care. So, when you assess the child, may mga doon sa chart natin, makikita mo na ano yung mga kailangan mong i-check doon sa bata. And when you do assessment, dapat ang ginagawa mo, you start from the pink colored. Okay? Mauna, kasi 'di ba, yung chart natin ganito siya. So dito, tapos yan. Dito is yung pink, and then sa baba niya merong yellow, and then you have your green. Yes, very good. So, when you do your assessment, titignan mo yung mga signs and symptoms na i-check mo under the pink first. Doon ka muna sa, you go first to the pink one, and then you go, kapag wala doon, you go now to yellow. Kapag wala doon, you go now to green. So, you follow it that way. You go first to the pink, then the yellow one, and then your green color. So, yun yung mga signs and symptoms that you will be looking for when you are assessing the child. Nakasulat na rin naman dito sa chart natin. And then, after assessing the child, you make your classification. So, yes, again, we have 3 color-coded classification. You have your pink, your yellow, and your green. With pink, this means that you need to do urgent referral, diba? Kapag yung patient is under pink classification, it is urgently referred. Kapag naman yellow, meron ka lang specific managements na gagawin sa kanya at the health center. But if it is green, now you will opt for home management. So if it is green, very important that you have to counsel the mother. And also, this is very important with your green. And also, yan, lahat naman. Okay, actually, sa lahat ng iyong classification, importante yung counseling. Now, after you classify it, you identify, and then you do the treatment na nakalagay doon sa chart natin, you counsel, and you give your follow-up care. So, very important in IMCI ang counseling. It's very important ang counseling the caregiver. If it's the mother or lola. So, ngayon, pag gagamit na tayo ng case management chart, ano ang importante na kailangan alam natin? What is your answer for this question? Ano ang importante na alam natin kapag gagamit tayo ng case management chart?
Age.
Yung chart mismo, yung chart. Itong chief complaint kasi, at saka yung problem of the child, halos magkapareho na sila, di ba? Yes, halos magkapareho na yung chief complaint tsaka problem of the child. In test-taking strategy, kapag synonym or magkapareho yung choices, we eliminate them. Kasi malamang sa malamang, baka mali yun. Or depende kasi syempre may mga choices na yung isa very general, yung isa very specific. Magkapareho man sila, parang magkapareho sila ng sinasabi, pero kung titignan mo, yung isa general, yung isa specific. So therefore, isa sa kanila ulit, pwedeng maging tamang sagot. But this one, kung titignan natin, they are almost the same. So therefore, kailan ginagamit yung chief complaint? This is a question kung gagamitin mo ba yung iyong IMCI strategy. So of course, pagdating ni nanay sa health center, tatanungin mo siya, ay syempre babatiin mo muna, magandang araw po, maupo po kayo, yon. So babatiin mo muna yung nanay. That is very important kasi tinatanong din yan sa board exam. Ano daw ang una mong gagawin kapag nakita mo yung nanay at yung kanyang anak na dumating sa health center? Syempre, unang-una, greet the mother and the child. Tapos, paupuin mo sila, make them comfortable. Okay? So now, tatanungin mo kung ano na yung problema. Kapag sinabi na inuubo, and then alam mo na, pwede kong gamitin ang IMCI. Pero kapag sinabi niyang nabukulan, ay hindi mo pwedeng gamitin yung IMCI. So, yan yung itong dalawa, itong C at saka D, ginagamit mo sila para malaman mo kung gagamitin mo ba yung IMCI or hindi. Pero kung ikaw naman yung masipag na nurse, ikaw yung masipag na health worker, at sinabi ng nanay na nabukulan yung kanyang anak, and then minanage mo yung bukol niya, depende sa ibang program ng ating Tapos nakita mo na ay parang payat yung anak niya. So pwede mo pa rin na i-check yung bata using the IMCI. Ganon. So yun. But then syempre, yung chief complaint, kinukuha natin yan para malalaman natin kung gagamitin ba natin yung program, yung IMCI program, or hindi. Okay? So now, ang nasa tanong is, sa pag-utilize mo nung chart mismo, anong chart ba ang gagamitin mo? Please take note that in IMCI, we have 2 age group. Diba? We have 2 age group. So, our 2 age group is this one. The birth up to 2 months. Kapag birth up to 2 months yung kanyang edad, if this is the age of the child, and then you will use the assess, classify, and treat the sick young infant chart. So, ito yung gagamitin mo na chart. Ngayon, kapag 2 months up to 5 years na yung bata, you will use naman the assess and classify the sick child age 2 months up to 5 years. Yes. So, you have to know the age para malaman mo kung anong chart ang gagamitin mo para doon sa bata. Okay? So, the answer would be letter
A.
A. Know the age. Okay. Another to please take note for this slide is the word up to. When we say up to, meaning less than. Okay? Meaning less than. So, kapag 2 months yung bata today, kapag 2 months yung bata ngayong araw, is dito na siya. Ito yung chart na gagamitin mo. This one, the assess and classify the sick child age 2 months up to 5 years. Pero kung bukas pa siya magto 2 months, ito yung gagamitin mo for the sick young infant. So, please take note ha, ang 2 months old na bata, ginagamit mo siya dito sa assess and class. Ang gagamitin mo na chart is assess and classify the sick child age 2 months up to 5 years. Pero kung less than 2 months, sick young infant. So, ayan. 2 months, less than 2 months. Okay? 2 months, less than 2 months. Magkaiba rin kasi ang general danger sign ng dalawang ito. Okay? Sa ating 2019 guideline, ini-specify na kung ano yung general danger sign ng sick young infant. But with the 2015 guideline, hindi pa rin. Parang hindi pa masyado. But with 2019, doon sa nabasa ko na African guideline is naka-indicate na kung ano yung general danger sign. I am checking naman doon sa inadapt ng Department of Health ng bansa natin. Okay? So, yun. For our this number, you should know the age para alam mo kung anong chart ang gagamitin mo. Kasi ang tinatanong is the case management chart. Okay tayo? Klaro? Okay, so next. Admit ko na ba si Ricky? Admit na nga natin. Okay, next. Danger signs will qualify for severe classification, suggesting urgent referral. Let's review first, ano yung mga general danger sign ng ating IMCI? Ano ulit yung mga general danger sign natin sa ating IMCI?
The child able to drink or breastfeed.
Yes. What else?
This, if the child vomit every.
Yes. Okay, so shortcutin na lang natin para hindi ganun kahaba. Ano? So, our danger signs, we use the mnemonic kuba. Diba? Kapag may danger, magkukuba ka para hindi ka... Okay, your kuba. Kuba. So, C for your convulsion. Convulsion. So, ayan. Make sure na you know how to describe convulsion to the mother. Or when the child is presented to you, you check if there is present convulsion at the moment. U for unable to drink or breastfeed. When you are assessing this one, unable to drink or breastfeed, you have to check if the child is able to swallow. So it's the swallowing capacity of the child that you will check here. Because children who are, kumbaga, pangit na yung kanilang status is hindi nila kayang lumunok. Okay? Hindi nila, yun, nahihirapan silang lumunok. For V is your vomits everything. Everything, ha? So this child cannot hold fluid or food sa kanyang stomach. So lahat ng ipinapasok ng batang ito, inilalabas din niya. Vomits everything. Okay? A for abnormally sleepy or lethargic. Abnormally sleepy or lethargic. So these are your 4 general danger signs. Your kuva. Kuva. Okay? So syempre, yung C, pwede mong tanungin or kaya pwede mo ring i-check kung nangyayari ba siya at the moment. Yung U, yan, mas tinatanong yan. Yung V, mas tinatanong yan. Yung letter A is ina-assess mo yan. Ginagamit mo rin yung iyong clinical eye. Ang problema with the abnormally sleepy, lalo na kapag mga baby talaga, which is lagi naman silang tulog, ito yung medyo mas mahirap i-assess. But you try, gisingin nyo yung baby, tapos kapag makikita mo naman yung difference ng baby na madali mong magising, tsaka yung baby na ang hirap gisingin. Okay? Lalo na, di ba, alam naman natin na sa mga baby, they still have your startle reflex, right? Ano ang stimuli for our startle reflex? You remember your startle reflex? Ito yung kapag may loud sound like that, o kaya kapag biglang nalamigan yung bata, so nag-i-startle siya. Nawawala ang startle reflex by 4 to 6 months. Okay? So, ayan. Okay. So, those are your general danger sign. Tandaan nyo lang, KUVA. KUVA, C for convulsion, U for unable to drink or breastfeed, V for vomits everything, and A for abnormally sleepy. Okay tayo? So tignan ngayon natin yung ating mga present sa ating kwan. So tignan natin. Yung number 1, stridor, chest indrawing, low fever with clouding of the cornea and deep extensive mass ulcers, walang general danger sign dito. Diba? So, walang general danger sign. So, therefore, mali si Roman numeral 1. Okay. How about Roman numeral 2? High fever, lethargy, and inability to drink. Meron ba siyang general danger sign?
Yes.
Yes. So, So your letter G and your inability to drink. So those are your general danger sign for 2. So therefore, correct si Roman numeral number 2. Now, stiff neck with high fever, tender swelling behind the ear. Meron ba tayong general danger sign?
Wala.
Wala. So hindi natin pwedeng isagot si 3. Kasi ang meron lang is mga severe signs, di ba? Yes, tender swelling is a severe sign kapag ginagamit mo yan na sign ng iyong mastoiditis. Ganon din sa stiff neck, isa rin siyang severe sign pero sa inyong malaria o kaya sa inyong malaria. Okay, now let's go to statement number 4. Meron ba tayong general danger sign with statement number 4?
Yes.
Yes. So, meron tayong unable to breastfeed, di ba? And difficulty to awaken. Halos pareho lang sila dito sa statement 2. Iniba lang yung kanyang wordings. Okay? So, yes, 4 is correct. How about statement 5? Meron ba tayong general danger sign?
Wala.
Wala. So, therefore, the correct answer would be?
Letter C.
Yes, letter C, 2 and 4. Okay, thank you. Now, let's proceed to your next number. In the INCI classification table, the color yellow indicates that let's see. So, here is our flow chart dating sa INCI. So, una, sabi nga natin sa ating case management process, we assess the patient. So, ano ulit yung ating mga danger signs?
Convulsion. Unable to drink or breastfeed. Miss everything. Abnormally sleepy and lethargic.
Yes, very good. So that is your general danger signs. So you first check for general danger signs. And then after you check your general danger signs, you check for the main symptoms. And then you assess also this, your NIVAF. NIVAF. So nutrition, immunization, vitamin A, feeding problems, and other potential problems. After that, you then classify your condition. I think you have your urgent referral. So nire-refer natin siya sa higher level facility. Pero bago mo siya i-refer, of course, you have to do your pre-referral treatments. So depende sa mga na-assess mo dito, syempre, pag classify mo siya, marami yan. Pwedeng marami kang classification. Hindi katulad ng diagnosis na iisa lang, di ba? Kapag ngayon nga, pwede na rin sila, ang dami na rin diagnose. Kapag nagda-diagnose sila ng isang pasyente, ang daming pwedeng lumabas na sakit. Pwedeng, syempre, kapag may diabetes mellitus ka, susunod na dyan, heart failure. And then susunod na dyan, kidneys. So, ganon. Susunod na, mata. Ang daming nadadiagnose. Also with your IMCI, ang dami mong pwedeng i-classify sa isang check mo doon sa bata. At kapag meron kang na-classify na kulay pink, kailangan mong gawin yung iyong mga pre-referral treatments. And then you have to advise the parents. Kasi kung minsan, sasabihin ni parent, pwede bang hindi na lang dalhin sa hospital kasi wala pa kaming pera. So, ayan, kaya ikaw talaga as a nurse, you have to be generalist kasi kailangan alam mo rin kung and also you have to have that social work knowledge. Alam mo kung ano yung mga options niya kapag pumunta siya sa ospital. Sasabihin mo na huwag po kayong matakot kasi meron naman, pwede naman kayong pumunta sa charity and para mas makita po ng maigi yung inyong anak. Ganon. So you have to, ang pinaka mahirap dito is yung pag-advise natin sa parents na pumunta ng ospital kasi kailangan talaga doon sa sitwasyon ng bata. Another thing when you do your advising the parents, syempre may mga medications or may mga kailangang intervention na kailangan niyang ipagpatuloy on the way to the hospital, like keeping the child warm habang papunta sila sa ospital, o kaya kung nilalagnat yan or nagkakaroon ng convulsion at mainit yung bata, kailangan niyang i-sponge habang they are on their punasan habang they are on their way to the hospital, or yung pagbibigay ng sugar water, keeping the blood sugar of the child na on check. Okay, so they have to do it on their way to the hospital. So yun, may mga interventions na kailangan ipagpatuloy ng parents habang they are on their way to the hospital. Okay, and of course you do the proper referral notes. Okay, syempre sa referral facility, itatriage na nila yan, ida-diagnose nila, iti-treat nila, and then they will monitor. Pwedeng, they will endorse it back to you for follow-up. Now, kapag ang condition is classify mo na yellow, then you will treat it at the outpatient facility. When you treat it at the outpatient, when you treat the child in the outpatient facility or in the health center, then there are specific medical management that you can do, like treating the local infection. You can do your gentian violet or your yes, more on gentian violet kapag IMCI. You do your oral medications, your oral drugs. So kailangan you teach the caretaker also, and you do the follow-up. Teaching the caretaker is very important. So you have to demo kung paano yung pagsukat ng gamot, kung paano ibigay yung gamot, and then you ask them for return demonstration so that you can evaluate if they were able to learn from you. Okay? And then to have your if you classify the child as green, then you have your home management. So, importante pa rin ang teaching the caretaker and counseling them. Then they do the home treatment, they do the feeding and fluids, and you have to advise them when to return immediately. Kahit dito sa yellow, dapat kasama dyan ang when to return immediately sa health center. Okay? And then the follow-up. So ito yung mga ginagawa natin under different colors. Okay? Color classification. So balikan natin ang tanong. So sabi, kapag yellow daw, ano ang ini-indicate niya? Of course, our answer would be A. Yes, letter A. So mali ang letter B kasi meron siyang does not. Letter C is under the pink. Letter D, lahat naman it needs an urgent attention. Okay? So yes, the answer is letter A. Now let's go to 84. Bimbi has cough difficulty. Has cough. Meron siyang ubo. Nahihirapan siyang huminga. There is chest indrawing, and there is stridor. His mother brought him to the health center immediately. The nurse should what?
Letter B.
Yeah. Your cough and difficulty of breathing, they are your first na main symptom. So they are your first main symptom. Okay? So yan ang first natin na main symptom. Ngayon, ang chest indrawing and stridor, these are the signs that you will be looking for under this main symptom. So your chest indrawing now is assigned under yellow. So nasa yellow yan. But your stridor is under pink. Okay? So under pink. Ang stridor nasa pink, ang chest indrawing nasa yellow. Oh. So since alam natin na merong isang pink, ano ang gagawin mo?
Refer.
Yes, you do the referral. So letter C is the correct answer. You give the first dose of antibiotic, which is sa ating bansa, it's amoxicillin, and then refer urgently. Okay tayo? So that is our answer. Okay? Please remember that in IMCI, if there is one sign in the pink, kapag meron ng one sign, paano ko ba i-express? So, kapag merong isa ng one sign in the pink classification, and then yun na yung magiging classification ninyo. Okay? Hindi kailangang marami. Kaya nga ang style natin, when we check for the signs and symptoms, inuuna natin yung pink. Kasi kapag meron na siya sa pink, yun na yun. Yun na yung magiging classification niya. Hindi mo na kailangang bumaba sa yellow at sa green. You go na to the next main symptom. Okay? Ganon siya. Maliban sa diarrhea. Siyempre, there is always an exemption. Okay? Now, let's go to number 85. Junjun, a 15-month-old child. O, sige nga. Doon sa ating chart, saang chart natin ipapasok ang 15-month-old na si Junjun? Di ba meron tayong dalawang chart? Yung young infant, tsaka yung young child, yung age 2 months up to 5 years.
5 years.
So si Junjun, saan siya?
Young child.
Yes, yung young child. Okay? So, 15-month-old si Junjun, ang kanyang kilo ay 9, experiencing diarrhea for 3 days. Okay? Experiencing diarrhea for 3 days. Sa IMCI, diarrhea is defined as 3 watery stool in a day. 3 watery stool in a day. You tell him not to be bad. Okay, 3 watery stool in a day. That is that's how our IMCI defined diarrhea. Okay, so now there are signs and symptoms presented to us. Kaya importante that you are well-versed doon sa mga signs and symptoms ng ating mga ng IMCI. So sabi niya, merong sunken eyes. Yung sunken eyes sa IMCI, this could be pink or yellow. Yes, nasa dalawa siya. Makikita mo siya sa dalawa. Nasa pink siya at saka nasa yellow din siya. Goes back very slowly. Makikita mo yan sa sign under pink. Drinks poorly is also
Pink.
Yes, nasa pink.
Pink.
So since puro pink yan, ano kaya ang magiging classification ni Junjun?
Severe dehydration.
Severe
Dehydration.
Severe dehydration. So, yes, thank you. So yes, letter A, the correct answer is A, severe dehydration. So, mabilis lang. Let's i-check natin kung ano yung mga signs and symptoms. Let's differentiate yung nasa pink at nasa yellow na mga signs ng ating dehydration. Okay? Under the pink one, you have your ASUS. Ang mnemonic na ginagamit natin is your ASUS for the pink one. So, A stands for your abnormally sleepy. Of course, your abnormally sleepy. S for your sunken eyes.
Sunken eyes.
Sabi ko nga kanina, sunken eyes. And your U for unable to drink or drinks poorly. Unable to breastfeed or drink. Ito yung chine-check, di ba natin, is yung paglunok dapat, ha? Kapag nag-check ka is paglunok. And your last S is, lagyan mo dyan ng V para malaman mo na it's very slowly. Ano yung very slowly na yon? Yung skin pinch. Okay? So, very slowly ang pagbalik ng kanyang skin pinch. Okay? Very slowly yung skin pinch. Okay. So itong ASUS na to, makikita mo siya sa iyong pink chart, sa pink. Sa pink. So kailangan dalawa. Ha? Kailangan dalawa ang mag-manifest. Di ba ito yung sinasabi ko kanina na exemption. Sa lahat ng pagka-classify natin is isa lang na sign, maka-classify na natin siya doon sa pink na yon or sa color na yon. But with the dehydration, you need two signs. Okay? You need two signs to be able to classify it. At dito naman, ilan ang signs natin? Isa, dalawa, tatlo. So, pasok pa siya sa banga? Yes, pasok siya sa banga kasi two signs or more. Okay, very good. Now, let's go to your yellow. Ano yung mga hahanapin mo naman sa yellow? Your dris. Dris. Sulat mo pababa. Dris. Okay, dris. So, D4, drinks eagerly. Okay. Ito yung mga akala mo laging uhaw sa pag-ihaw. So, drinks eagerly. R4, restless. Pwedeng iyak ng iyak, gano'n. I4, irritable. S4, sunken eyes, ulit. Kaya nga sabi ko yung sunken eyes, makikita mo siya sa pink at saka sa yellow. And then another S4, slowly. Ano ulit yung slowly? Yung kanyang skin pinch. Kung kanina sa pink is very slowly, dito is slowly. Okay? Skin pinch. So, yan ang hahanapin mo naman kapag ang kinaklasify mo ay some dehydration. And kailangan mo ulit ng dalawang sign. Okay? Kailangan mo ng dalawang sign. Ang restless at irritable, iisa lang yan ha. Counted as one ito. Counted as one siya. Okay? You're restless and irritable. Okay tayo? Oh. Siyempre, kapag pupunta ka na sa green, sa no dehydration, not enough signs. O, kumbaga, isa lang yung nag-manifest dito sa yellow. Drinks eagerly lang. So, therefore, no dehydration siya. Okay? So, ganun. Now, let's go to your number 86. Basta ang INCI, ilan ang points ninyo? Anong mga score? Sino ang anong mga score? Anong mga score nyo? 3, 4, 5? 3 to 5 ba? Karamihan? Tahimik sila.
Yes, ma'am.
Anong mga score niya?
4.
4.
3.
Yung iba? 3. Yung iba pa?
3.
2. Okay. Para malaman namin kung isasali natin siya or okay. Hindi na kasi siya masyadong tinatanong, but of course, since while we are browsing nga with the exam, halos parang 2008, parang ang mga ano yun, yung ni-recycle nila na question is from 2008 yung iba. Mga nakikita ko. So, yun. Kaya medyo kailangan din natin i-review siguro somewhere back then. Okay? Okay. So, yan. Now, let's go to your number 86. Diba? Maternal mortality is still a problem that needs to be addressed since it is considered as one of the sensitive indices of health situations. So, providing prenatal, intranatal, and postpartum care would adhere to ano daw MDG. So, wag kayo, kahit alam natin na ngayon is hindi na MDG, Noong 2019, tinanong pa rin ang MDG. So yun ang patunay talaga na nagre-recycle sila ng questions. Okay? Yun yung patunay na nagre-recycle sila ng question. Okay? So now, that's why it's very important that we have to go through to the old questions, kahit mga luma pa, ganon. So we have to go through to those. Para sayang naman ang 1 point kapag lumabas siya sa inyong exam. Okay, so wag niyo sasabihin, ano ba naman yan, ang luma-luma na ng tinuturo nila. Wag ganon. Kasi lumalabas naman kasi siya. Kaya we have to address that. So what's your answer with this question? 86 na pala tayo. Yeah, so what's your answer with this? Anong MDG ang may kinalaman sa buntis? Tignan nga natin. Itong
5.
task na to, yes. So itong 8 na to, these are your MDGs. So these are your MDG. Itong sa baba, is siya naman ang inyong SDG or Sustainable Development Goals. So syempre ang naglabas nito is yung United Nations. Okay? So, sa MDG, ang maternal health is under Millennium Development Goal number 5. Sa SDG, saan papasok ang inyong maternal health?
SDG.
Wala na ano, pinag-isa na lang siya lahat dito sa number 3. Sa good health and well-being. Unlike dito na, ayan, diba? Reduce child mortality, number 4. Number 5, maternal health. Tapos, HIV/AIDS, number 6. So, 3 ang talks about your health. Siyempre, maliban sa dito, this also can be considered your number 1. Okay, but with the SDG, saan na lang siya pasok? Sa inyong good health and well-being. So, halos nasa iisang area na siya. Okay, so yes, the answer will be number 5, letter D. Next, number 87. A mother received her first booster dose of tetanus toxoid on September 1, 2013. When should the nurse instruct the mother to return for the next shot? What is our answer? Ang booster dose, ang first booster dose, please take note, this is your TT3. Ito ang kanyang pangatlong TT. Okay? So that is your TT3. Diba? Ang interval ng TT3 at TT4 is at least
1 year.
1 year. Yes. So at least 1 year.
1
So
year.
therefore, your answer would be,
Letter D.
yes, letter D, September 1,
8.
2014. Okay, 2014. Next, number 88. After the delivery, the nurse knows that the first postpartum checkup should be conducted. Ano?
Letter A.
Yes, you're within 24 hours. Okay, within 24 hours. Next, number 89. What is the standard tool to record vital information about the mother and child which is kept in the home? Sa bahay, iuwi siya sa bahay.
Letter C.
Letter
C.
C, your mother and child.
Child book.
Okay. And please take note, it records yung mother and child.
Child.
Okay? Sa iba kasi, they are, di ba ang family treatment record yan sa clinic. Tama? Nag-root monitoring chart, para lang ito sa child. The home-based mother's record, para lang naman kay mother. Ang tanong, mother and child. So, yan din yung, kumbaga, sa test-taking strategy, they call this as reappearing visage. Yung nakikita mo siya sa tanong, mother and child, and makikita mo rin siya sa sagot, mother and child. So, kapag may mga, yan, they call it reappearing visage. Diba? Kung ano-anong tinatawag nila. So, yan, isa sa test-taking strategy na sinasabi sa atin. Kung makikita mo raw siya sa question at nakita mo sa answer, malaki yung chance na siya ang tamang sagot. Okay tayo?
Yes, ma'am.
Yes. Let's go now to number 90. Okay. Which among the following is not covered by a BMONG facility? So, this will be tackled more ng inyong ratio tomorrow. Okay. So, basta ang sagot dito would be your letter boy. Okay. Not covered by BMONG facility is administration of corticosteroids in preterm labor and gland. Okay. So, you will delve deeper tomorrow. Next, number 91. The use of iodized salt is mandated by which guideline in the nutrition program? What is your answer for this? Okay, tingnan nga natin. Ito yung Republic Act, which an act on salt iodization nationwide. This is our ASIN law. So, nangyari ito noong time ni Fidel Ramos. Kaya nga merong Fidel seal para sa mga kapag they are fortified with iodized. So makikita natin dito, sabi niya, the law is to contribute in the prevention and control of iodine deficiency disorders. Because kapag isa sa mga problem na na-encounter natin kapag meron kang iodine deficiency of your goiter. Okay? So sabi, food grade salt producers or manufacturers are mandated to iodize the salt that they produce, manufacture, import, trade, or distribute. So lahat daw po ng asin dapat na fortify with iodine. Okay? Food outlets, restaurants, and stores are required to make this available to their customers in their establishment. So kapag nagpunta kayo sa isang restaurant or isang store at naghanap ka ng binibentang asin at hindi ka binigyan ng fortified with ng iodized salt, then they are breaking this law. Kahit nga daw sa restaurant, pwede kang mag-demand ng iodized salt kasi it's in the law. Okay? So, yan yung about sa ating asin law. Now, your use of iodized salt is under the micronutrient fortification ng ating which is a guideline for the nutrition program. But then there are some updates with this, so we have to check that again. Pero sa old na nutrition program natin, this falls with your guideline in number 8, letter C, guideline number 8. Okay? Next, number 92, moon-shaped and unhappy face is a manifestation of which protein energy malnutrition. So protein energy malnutrition is ano siya? Yes, your kwashiorkor boy. Okay? So makikita niyo sa picture yung difference ng dalawa. So kapag kwashiorkor, makikita mo ang taba niya. Bakit siya parang mataba? Because of edema. Okay? Dahil sa nagkakaroon, kulang siya ng protein. So, yung protein na humahawak doon sa fluid para mag-stay sila sa intravascular space or sa loob ng blood vessels, wala, kulang. So, ang nangyayari, pumupunta yung tubig sa mga interstitial space, causing your edema. Okay? Sparse hair, bakit? Alam naman natin ang buhok natin ay gawa sa protein. Moon face, because of edema. Flaky appearance of the skin, of course, kasi alam naman natin, it needs also protein. Swollen abdomen dahil din sa fluid shift, nag-shift yung tubig. Thin muscles but fat is present. Okay? So yan ang itsura ng ating merong kwashiorkor. In comparison with marasmus na normal lang yung buhok, old man or wizened appearance, limbs with little muscle or fat are very underweight body. So ang payat-payat niya. Okay? So, yan, madali siya kapag ganyan, pero kapag ganito na, di ba, hindi mo aakalain na may sakit itong batang to. Di ba? Kung titignan mo, para siyang healthy. Yun pala, pag hinawakan mo yan, makikita mo na, it's edema. Okay? So, kapag actual na actual setting na, yan, mahirap nang i-check. Titignan niyo. Okay? Next. 93, vitamin A supplementation is given to children as early as 6 months. So, bakit at 6 months? Kasi by this time, nauubos na yung galing kay mother. So, eligible infants and children will follow which vitamin A supplementation is scheduled. So, when we do your supplementation, your answer would be letter boy. Today and after 6 months. Yes. Kasi every 6 months ang pagsusupplement ng ating vitamin A. Now, letter C is when you do your vitamin A treatment. Okay? Vitamin A treatment. So, when you treat the child with na merong vitamin A deficiency, you give today vitamin A and then tomorrow and then after 2 weeks. So that's the way on how you give vitamin A as a treatment. Yung letter B is how to give vitamin A as a supplementation. Now, since nasa vitamin A na rin tayo, is idagdag ko na, when you do your supplementation, ilang international units. Ang pinaka Q natin is the 12 months or the number 12. So kapag more 12 and above na yung bata, 12 months and above na yung bata, you give 200,000 international units, okay, of vitamin A, 200,000 IU. Kapag 12 months and above na yung bata. Kapag less than 12 months, you give 100,000 international units, okay, or 100,000 IU. So ito yung magiging hati mo, ha? So 12 months, kapag 12 months and above, 200,000 international units. Kapag below 12 months, 100,000 IU. Okay, so that is for your vitamin A. Sa pagbibigay mo ng vitamin A, either as a supplementation or as a treatment. That's number 94. Sangkap Pinoy seal is required by the Food Fortification Act to be printed on food packaging of staple food that are being fortified. Which among the following is the color of vitamin A fortification? So alin dyan ang color ng vitamin A fortification?
Blue.
So ito yung seal. Okay? So ito yung seal ng ating Sangkap Pinoy seal. So ano ba ang mga pagkain na rich in vitamin A? Ano ang sabi ng teacher natin nung tayo ay kinder? Anong kulay ng mga pagkain? Yes, mga kulay dilaw or orange. Yes. So therefore, dito sa ating Sangkap Pinoy seal, itong kulay yellow na to, siya ang nagsisignify na na-fortify siya ng vitamin A. Okay? Vitamin A. So letter B, yellow. Ngayon, ano kaya itong kulay green na to? Ano ang dinidenote nito? Na yung pagkain na yon ay na-fortify ng anong nutrient? Micronutrient.
Gulay. Joke lang.
Yes. O, saan mayaman ang gulay? Lalo na yung mga leafy greens.
Iron.
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 Yes, iron. So, so yes, iron. Kapag itong kulay green, it is fortified with iron. And kapag itong kulay red, it's fortified with iodine. Okay? Kapag yung red is iodine. Kasi 'di ba, yung mga seafoods natin kapag naluto sila, nagiging kulay red or
Red.
orange. Tama?
Yes.
Oo. So sino ang ulam diyan ngayon ay sugpo o kaya shrimp o kaya ang niluluto nila ngayon ay crab.
Sana all.
Sana all. Okay, next, number 95. Food Fortification Act is otherwise known also as your RA 8976. Okay, your RA 8976. Next, number 96. Your Sentrong Sigla movement, this is the sign ng ating Sentrong Sigla movement. Naku, nag-ingay na sila. Di ba, malapit na lang. Pagpasensyahan nyo na. Sentrong Sigla movement is a result of the collaboration of the Department of Health and our answer here would be your local government units. Kasi ang Sentrong Sigla movement, ayan sabi dito, is a program ng Department of Health to promote availability and quality health services in health facilities, lalo na ng ating mga health centers at ng mga rural health units. Kaya kadalasan itong sign na to, itong nasa side, itong image na to, madalas mas nakikita natin dito sa mga rural health units or mga health centers kaysa sa hospital. Okay, kaysa sa hospital. Next, the promotion of the concept of wellness as a personal responsibility and increasing awareness and demand for quality health service is an element of which SSM pillar. It is your health promotion. Okay? Health promotion. So, concept of wellness, di ba? Wellness state. Okay? Next, number 98. So for this one, the expected results of SSM for the institution include advocacy for laws that promote health. So dapat ina-advocate nila yan. Develop system for surveillance and merits. Yan, nag-a-award sila. And to develop quality service for health providers. Okay? The award pillar of SSM is in line with which of the following? Yes, your recognizing and accrediting facilities that deliver quality health. So with our SSM or the Sentrong Sigla movement, meron kang leveling din dyan. Meron kang level 1 or level 2. Or sige na nga. So meron silang basic SSS certification. So, nagbibigay sila ng basic SSS certification. Kapag nabigyan yung ating healthcare unit ng basic SSS certification, ibig sabihin, there is a minimum input, process, and output standards for 4 core programs. Madugo to. Okay? And then meron ka rin specialty awards at saka awards for excellence. So specialty awards, bibigay sila ng specialty awards. And then nagbibigay din sila ng awards for excellence. Okay? So yan yung mga tatlong certificates na pwedeng i-award ng ating para dito sa award pillar. Okay? Awards for excellence. So, yeah. Okay. So, yan yung ating mga ina-award. Number 99. The SSS certification is valid lang for 2 years. Tapos kailangan ma-renew siya through accreditation. Which among the following are included in the scope and structure of Level 1 SSS Quality Standards? So, under the Level 1, meron kang 1, 2, 3, and 4. So, ito yung mga chine-check nila under Level 1. Facility and System Standards. Ibig sabihin, ini-ensure ba ng health facility na appropriately equipped sila, meron silang sapat na tao, meron silang sapat na supply, organized ba yung kanilang procedure. So yon ang chine-check with Facility and System Standards. Dito naman sa Integrated Public Health Function Standards, they check if the health facility and the staff promote yung mga health programs. Okay, pinopromote ba nila yung mga public health programs? And they prevent and control health problems. Through yung kung paano na nila paano na ba nila ini-implement yung DOH program. So yun yung chine-check dito sa number 2. Sa number 3, basic curative function, of course from the word itself, yung curative services naman no facility na yon. With regulatory function standards, this is more of how they support and provide an environment to prevent risk and hazard doon sa community. So, more naman ito sa preventive aspect. So, yan yung chine-check pag level 1 SSS quality standards. Itong dalawang ito, 5 and 6, level 2 na ito, under the level 2. Okay, so under level 2. So our answer for number 99 is letter A. 1, 2, 3, and 4. And last number, all of the following are programs covered by our Sentrong Sigla movement except for voluntary blood donation program. Kasi yung voluntary blood donation program, mayroon siyang sarili. Kumbaga may sarili siyang way on how to check it. Okay? So, yun po ang ating community health nursing. Kumusta naman ang ating mga scores? Kumusta ang inyong mga score?
Mabigo.
Okay, so yun, kindly gawin nyo yung sinabi ko kanina. You go per, di ba, per topic naman yan eh. Every 5 questions is naka-core sila sa isang topic so that you will know kung ano yung mga talagang super, wala, konti-konti talagang nakuha ko dito. Ganun. So with that, you will be able to maidagdag nyo or mailagay nyo na priority na babasahin ninyo or at least you give some time para mabasa yung topic na medyo kulang pa. So magsuswot analysis kayo ha. So your strength, your weakness, what are the opportunities and the threats. So magsuswot analysis po. So with that, let's call it a day for our rationale and prepare yourself later on para naman sa inyong first lecture which is emergency nursing. Okay? So mag-lecture kayo today ng first part ng ating emergency nursing and bukas ng hapon ulit yung another part ng emergency